is either bacteria, fungi, or even viruses. But majorly, bacterial infection are the worst. So, the most common bacteria causing pneumonia is called Streptococcus pneumoniae. And of course, we have other viruses like influenza viruses. We have there's a virus called respiratory syncytial virus. There are other viruses like Streptococcus pyogenes. They're not the okay. The next slide after that. So they will be having fever, the chills, aching of the muscles. Some of them will be coughing, and this one is a very common, symptoms. Then they'll be having sore throat. Someone will be producing, a very bloody sputum, and even enlarged limbs. So there are some of the symptoms that literally indicate that this person is having tuberculosis. So you can go up. In that slide where there's a picture, you can see the symptoms of this virus, of this condition, in different parts of the body. For example, if you look at the heart, the heart rate will increase. Look at the joints, there will be pain in the joints. Look at the gastric, the GIT. It can induce vomiting and nausea, though that is some of the mild symptoms. Then in the center, like in the brain, you are most probably to have headache, loss of appetite, and even mood swings at the same time. But the major symptoms have been able to highlight. If you see fever, these people are coughing, having sore throats, they are having bloody sputum. There are some of the major, symptoms. Look at the lungs. This cough, sputum, there's shortness of breath, pleuritic chest pains, and even hemoptysis. So these people probably they may also be feeling fatigue. And so this inflammation is very dangerous. Imagine we talked about the first stage to the respiratory system, and we said one of the primary basic functioning of your system is the airways, the circulatory system, and breathing, the ABCDs, and of course we added D. So imagine in this condition, your airways and your breathing system is interrupted with. So you can go to how can we now manage this condition. I said this is more of a recap of what we did the other time. So one of the things we are actually targeting in this condition, number one, is to eliminate the bacteria or the virus or any like the causative agent. That is the main target. And before I speak about treatment, this is not included in my slide, but let me treat about how do you now diagnose, how do you now come to know that these people are having tuberculosis. And this is a very deadly disease. So in our respective labs, there are tests for tuberculosis. If you do a peripheral blood count, there's a test called it's called acid fast bacillus acid fasting. So this is a test just to just diagnose the presence of this is pneumonia. Sorry, that is pneumonia. That is tuberculosis. Sorry, that is not pneumonia. In pneumonia, we can actually do a laboratory test to confirm the presence of Staphylococcus pneumoniae. And so don't go back, just go where you were the other thing. Yeah, so basically, you can do several lab tests to confirm that these people are having pneumonia. But sometimes these ones are false. They give false results, because if you remember, when we talked about bacteria having the normal, like occupying the the bacteria themselves being the normal flora, and even the commensals of major respiratory tract system, including the 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 the, the track. So, how can we now manage? Like, you've known that these people are having pneumonia. So, number one, you you want to you want to prevent the cold or the flu from going into the lungs. If at all the condition has not worsened down in the lower respiratory tract. So rinse out the nose with salty water, then gently taking it in and blowing it out. You rinse out the nose with salty water, and this one should be done very gently. Then after that, uh, then repeat the rinsing, like the gangling with good seal. I hope you guys know this antibacterial agent. Then leave alone the mayo mixer, but you can use God seal or just pure salty water. Then this one will actually prevent the flu or keep a cold or a flu from actually getting down the lungs. But if the lungs are already affected, and it has worsened, so you stop this procedure. This one is only done in the very acute phases of pneumonia. Yeah. So, secondly, in such conditions, you can go to the next slide. Advise these people to drink plenty of water. Water, like, this is just working properly, and only liquid the first few days of the application. So this one should be dilated pineapple juice and all that. The plenty of heavy milk in touch. We were able to see basically. Okay, someone is there. I can't see immediately. It's true, Fena.
Yeah, sorry. Oh, sorry. No, I'm sorry.
Oh, well, yeah, thank you. So, when you are starting the management of the, so this can consist of fruit juice, you have pineapple, oranges, and all that, even lemon. It should not contain sugar. Cayenne has high paclitatic content, which can easily stimulate the release of the mucus that narrates the pathogen. So, you can take cayenne. You can mix some lemon juice with cayenne that the cayenne pepper, and just maybe a half a glass twice a day, as frequently you get an alternate number of times. This one also helps, but the cayenne also helps to increase the respiratory activities that will even enable you to expel more of the sputum and all that, so that you also clear out you also release the bacteria. So there's a natural remedy called fenugreek. You can go to the next slide. Fenugreek seed also have a mucolytic property, and mucus, from the word mucus, mucolytic property actually help to break up the congestion, and this one also increases the metabolic activity, which leads to sweating increasing, and even more toxins are able to to be removed from the body. This one has really been proven to act against mostly the Staphylococcus and the Streptococcus bacteria. So we talked of Staphylococcus, Streptococcus pneumoniae, which is the main cause of pneumonia. So you can take a fenugreek tea, and by boiling 1 teaspoonful of fenugreek seed into 500 millimeters, about 2 cups of water, then you just drink it. 4 cups of fenugreek tea a day. And you can also add a little of lemon. So all those are there. I don't know where this seed is found. This seed called sesame seed. You can also go and check it. I also don't know about it, but it's one of the most effective seeds. I'm not sure whether it's in Kenya to manage pneumonia. You can go to the next slide. You can also take a salt water gargle. Of course, this one I've talked about, where you just you take a quarter to a half teaspoonful of glass to warm water, then you just mix them. Then you can as well drink it. And I also talked about this. The saltwater gargle when you are now cleaning, the nose, and you don't make sure like the water doesn't go into the windpipe. So that is one of the way you can do this. Sometimes you can do a lukewarm compress, where sometimes you just take, how is it called? You just take quite a warm water, then you put maybe a cloth there. You do the lung compression, and by physically doing that, you gradually manage the temperature. And this one helps even to reduce fever when this person is having a fever and all that. One of the risk factors for pneumonia is when there's, decreased temperature in the environment. So what happens is that you can go to back to the previous slide. What happens that when you are in this condition, when you are in these temperatures, that is the low temperature, these conditions worsen. This is a very dangerous condition, and at this point, you are literally required to manage the temperature so that you keep the body into the required temperature. Now, another risk factor for pneumonia is immunocompromised people. People, for example, having HIV, AIDS, and other conditions. So what happens is that these people's immunity is down, and what has attacked the body is actually the bacteria. And so even as you try to do this, one of the key elements to regulate is temperature. Number 2, work on foods that basically builds your immunity. Then number 3, work on foods which are antimicrobial, and we'll be able to name them. We've named fenugreek, we've named, of course, about ginger, about cayenne peppers, about cayenne peppers, about garlic. We talked about internal blood detoxifiers, and the ones that basically used to manage the antimicrobial. So one of them is also called turmeric. So you can go to the previous slide. So if you make a turmeric powder in warm mustard oil, then you just make a paste and rub it in your chest. This one also helps, to just relieve the pain. Turmeric also help to improve your immunity and all that. These are some of the things. Even as you do the cold compress and all that, you can use that. And turmeric also should be taken like you should cook it with your food so that it also manage your internal system. So consider turmeric paste for external use and even a cook of the same. So leave alone the milk I've stated there, because that was just a recommendation of someone, but turmeric basically do the same thing. So I've given all about turmeric there. So other things that you can consider is maybe taking honey. We have jaggery. We have thyme leaves. We have the grapefruits. I've talked about cayenne. I've talked about ginger. And rest is very important in managing such conditions. For any person suffering from pneumonia, rest is very important. And this one basically help your system, to relax. Sometimes, if you engage in other activities and all that, you may even worsen the situation. So even as you consider taking the fruit juices, the antimicrobials and all that, consider rest to such people. So you can now go to the first slide. Okay, thank you. So let me speak briefly about tuberculosis. You can see we have 15 minutes. So tuberculosis is a chronic progressive mycobacterial infection. So that is the second slide. And it's often asymptomatic, meaning like you cannot really tell whether these people are, you can literally not see the signs. So mostly or basically it affects the lung, but we'll be able to see in a few how tuberculosis actually can also be associated with other conditions. So what is the cause of tuberculosis? There's a highly contagious bacteria called Mycobacterium tuberculosis. Mycobacterium tuberculosis. So that is the next slide. Thank you. So Mycobacterium tuberculosis is the major cause of tuberculosis, and this is a disease, and it affects the lungs, as I have said. So it can as well attack, several parts of your body. Like we have the knees, the bones, the skin, the intestine, and the upper respiratory system. It's not an exception of the same. So, and including the liver. But in such cases, they are rare. They are rare cases. So the next slides explain how actually TB spreads. So when I don't know whether you guys will be able to understand the bacilli. Okay, in bacterial classification, we have different classes or different classification. We have gram-positive and gram-negative. Cocci means they are round. Then bacilli means they are rod-like shaped. They are rod-like, they are rod-like. You understand what a round thing is? That is a cocci. But a TB is a bacilli, so it's a rod-like shape. So when someone is having TB and they dispense it into the atmosphere, you can easily inhale the Mycobacterium tuberculosis bacteria into your lungs, literally. So after inhaling, that is why we are saying it's an airborne, bacteria. So after inhaling it, it goes into your lung. So here, it can take two parts. Number one, it can either go into your bloodstream and even reach the lymph nodes, or it can be it can go through an unspecific, pneumonitis, and this one remain dormant in your lungs for a few years. I think we'll be able to see how actually you also develop. Someone can be having Mycobacterium tuberculosis in their lungs, but this it's not manifested. Like these people are not having diseases. So you can go to the next slide. What are some of the symptoms that you will actually you'll be able actually to see and perfectly conclude that this person is having TB. Even as we do that, let me ask this question. At what age is someone vaccinated on TB? When do we get the TB vaccines, tuberculosis vaccine? You can answer them in the chat box. At what age and how many times do we get these vaccines? So, given that this is a condition affecting the lungs, there's a lot, these people are generally coughing. And coughing, the day comes with even fatigue. These people are just tired. They don't have much appetite. They keep on complaining about their pain, the chest pains. They have night sweats. They have low-grade fever, and sometimes in acute phases, there's actually high-grade fevers. Fever is just increase in body temperature. So the cough at first is not too productive, but later increasing amount of phlegms and coughs are observed. Then a person loses weight. Sorry, I think I didn't. Yeah, the person loses weight just rapidly, and the sputum production as well. You guys know what sputum is. That it is called a very heavy respiratory extract that someone removes. It may be part of the mucus, but it is mucoid. It is mucus-like. So those are some of the conditions. There are some of the symptoms we see first. So after assessing this, we can also do laboratory tests to actually see or confirm this condition. So this is where I was talking of a condition, a test called acid fast bacillus test, which is used to actually see the bacteria in the sputum. So one of the specimens collected as the sputum, then they are stained, then they are viewed microscopically, and you can be able to see red like rods in the stain. So those the symptoms, and basically you have to confirm most of these symptoms must basically appear so that you conclude that one is having tuberculosis. And these are some of the deadly diseases. Though tuberculosis is almost, how should I say, it's almost a it's okay. Managing and treating tuberculosis so that all the antigen that the bacteria itself has introduced into the system is nearly impossible. But then in the test, I forgot something, that we can also do rapid tests just to test for the Mycobacterium tuberculosis bacteria. So before you're very sure about this, just make sure you do those tests. So of course, yeah, you can go to the next slide. Of course, as I've spoken about the cause of this, spread by coughing, then tiny droplets in are inhaled by others, then the germs usually enter the lungs and remains there. They can also be coated. So the most important thing in managing tuberculosis is a healthy lifestyle. And by the way, in all the diseases we've been talking about, New Start is the only natural remedy to manage all this. We started these classes by talking about New Start, where we have nutrition, we have exercise, we have water, we have like all that, including temperance, all that is the only natural way to curb any disease. And so TB is not an exception. Healthy lifestyle and and uh, and we will be also able to talk about the management. So as long as the person maintains a healthy lifestyle, the body encapsulates the germs. That is, a tiny calcium cell is placed around the TB germ to render it harmless. This is one of the mechanisms the body is using, to curb TB. And so you may be having Mycobacterium tuberculosis viruses in your body, but you don't know. And there's no manifestation of the same, just because of formation of a tiny calcium cell around the virus, making it to be harmless. So how do we manage? How do we manage this condition? I'm not sure whether you guys have seen someone having TB, but let's go to management. So the treatment is obviously a matter of, retracing one step and doing what he should have done earlier, to prevent this condition. So initially, he must overcome the critical phase of the disease with fasting. And this is very important. But there I don't mean dry fast in this case. I mean more of food fast and more of water fast. So fasting, rest, and good food in the very initial stages. But later, this person can take time each day to do something like out of door activities. Resting helps improve, the recovery process. Fasting also helps improve the recovery process, but using the 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 fruits and the vitamins which promote, recovery and all that. Remember, this is a bacteria, so we are also working towards managing the bacteria. So the next slide. I've talked about the bacteria remaining in you and sometimes just don't cause any effect. Yeah. So once you are on your feet again and appears to be well after having that fruit fast and all that, I'm yet to talk about some of the antibacterial agents for TB. But once you start getting better, this is a lifetime process. So you can continue with your program for careful eating and living, outdoor, maybe scrolling and all that. One of the major symptoms for tuberculosis is that you appear very weak, and the loss of weight is very rapid. And so rest is very key in this case, and you will not even be having, energy to stroll and all that. So we are actually trying to manage your energy levels. Number two, we are trying to manage the the microbial, that is the bacteria. And lastly, we are trying to put you at rest so that you regain it all. So the last statement just talks about how TB has been resistant over time. and it's becoming, a disaster. Of course, there's the vaccination and all that, but TB is turning to become a disaster because of what we call adaptation and the resistance to most antimicrobial drugs which have been given. So you can go to the next slide. I talk about a few things about management of tuberculosis. Go to the next one before that. No, after that. The next slide after that. Okay, fine. So one of the things we are basically trying to do in management of TB is taking foods rich in vitamin A, C, B, and E. A, C, B, and E. Actually, these are some of the immune boosters, vitamins. They also promote recovery at the same time. You are considering a protein-rich food, yes, but remember, you will prefer plant-based food in such cases. So, of course, you're also considering food rich in calorie because these people are lacking energy. So they also need energy for the normal functioning of the body. We have different types of mints that you can also use. We have the peppermint, and the peppermint can be inhaled with an interval of maybe 4 hours, 4 to 6 hours, three times a week, 3 times a day, 3 times a day, 4 to 6 hours, an interval of 4 to 6 hours, 3 times a day in such conditions. Then, cayenne is also a very good remedy for this. As we talked about it in pneumonia, it also helps, to increase your respiratory, your mucus excretion, so that you aid the process of removing, the bacteria. We have other antimicrobial agents. I've talked about ginger. I've talked about garlic. There's this powerful one called the neem tree. I think it's called mwarubaine. It's also very important in any antimicrobial, use. So these are some of the things we can consider when basically dealing with tuberculosis. And this very important weed, it's called mullein weed. You can just go to the next slide before we go back to the other slide. So this one has been found to be a very good antimicrobial for tuberculosis. And I think I just didn't include the research. The research showed that using this plant, I think you can always identify where it is, because I think personally I've seen it, but I'm not sure whether you guys have seen it. It's a very common plant. Studies have shown that the usage of this plant for only 3 days, 2 times a day, can actually eliminate the or manage TB completely. Whatever will be remaining is just the now antigen formed for TB. So you can go to the slide we left about increased general vital resistance. That one. This is always a mistake people do, that when you produce sputum, you swallow it back again. This is very dangerous, and it basically increases your viral load, not viral load, your bacterial load for such conditions. So under normal circumstances, when you produce sputum, just make sure you excrete them away. So for people with TB, just make sure you expose them to an open air and just let them sleep in a cold, well-ventilated rooms, even as you try to manage these conditions. Because if you compromise such treatment, then you are even exposing them to worse conditions, and this one may basically lead to death. So, lastly, we are also trying to increase general vital resistance. Like, for example, you want your thorax, the thoracic cavity. You want your lungs to to have a proper ventilation. So in such cases, you can consider a cold bath, and I also talked about lukewarm baths. Doing it twice a day, and can also do systemic exercise depending on the conditions you are. You all can agree with me that exercises basically improve your respiratory how should I say, like it increases your your respiratory system, to enlarge and just to relax, and even to excrete more of the things blocking the respiratory system and all that. So consider systemic exercise depending on the condition these people are, and out of door, like take a walk. You can also, the rest are also there, and this one can be done like daily or 3 times a week. Yeah. So you can see it's 9:19, and that is all about TB, what I wanted to talk about today. So in the next 1 minute, I'll just speak about a condition called emphysema, and this is a lung condition. You can go to slide 12. Yeah. So emphysema is a lung condition that is basically causing a shortness in breath, and over time, the inner walls of the air sacs basically weakens, and so your heart is lacking elasticity. So this one will basically create, larger air spaces, and sometimes, most of the time, this is an irreversible condition where the shortness of breath, your lungs are not that elastic, and this larger air spaces at the same time, and yeah. So one of the causes for this condition is mostly it's called smoking. Yeah, smoking. Smoking is actually one of the major causes. Of course, we have other things like lead poisoning, heavy metal poisoning, and all that. So I am sure we have talked about bronchitis, if I'm not wrong. The same way you will manage bronchitis, the same way you will manage how is it called, lung congestions, is the same way you will manage this condition called emphysema. So that is all. This is now more of a chronic conditions of most of the lung complications. So that is that. In managing of emphysema, just as I said, new start is very key. So just make sure you quit smoking, you improve your quality of air quality in the home, you practice just regular exercise so that you also, free out the airways. Make sure you manage your stress levels, maintain healthy weight, because you realize one of the things that make us to have strains in the lungs and all that, the airways are blocked, or the airways are blocked by the thinning of the vessels themselves. Vessels is not the right word. By the pipe itself. So you should just maintain a heavy weight, healthy weight, and develop, a muscle strength. And this one can exercise is the solution for that. Then water-based exercise can also be employed in this, and also taking much water for the same. So I think that is all for today. You can see 9:22. For the 3 conditions I've been able to do today, do you have any question or any addition?
Probably an addition from my end.
Yes.
So I'll start by emphysema. I'll start from emphysema, and I just wanted to add a list of herbs that can be useful in treating and managing this condition. So, number one, if emphysema is just a disease that makes someone breathless, and it can often be confused with asthma. So on treatments, one of the things that you really need to use is you need to increase vitamin C intake. Vitamin C intake, you need to increase the intake of foods that are rich in vitamin C. The first thing when you wake up every morning, squeeze one whole lemon in a glass of warm water and take it to boost your immunity, to cleanse your blood. And throughout the day, you can also use a list of foods that are rich in vitamin C to cook, even as an additive in your food. And then secondly, there's this drug called eucalyptus oil, which is very high in a component called cineol. If you are writing, you can write it as cineole. So eucalyptus oil always will help with respiratory diseases, no matter the type of disease, the respiratory disease, be it TB, be it pneumonia, it will always help. So you can include eucalyptus oil to your list of recommended herbs under emphysema. And then we have cardamom. I've never known how to pronounce it well, but I think it goes that way. Cardamom, Cardamom, I believe that's how it's spelled, Cardamom. So cardamom, it's a spice. You can always use it to cook your food, or you can just use it to make tea in case when treating emphysema. And then secondly, we have mullein, which is a very powerful herb for respiratory disorders. And then we have red pepper, that is cayenne. It has very good sources of vitamin C. So you can make a tea from red pepper, mullein, cardamom, and eucalyptus, the 4. Red pepper, mullein, cardamom, and eucalyptus. The 4, you can make a tea from them. Maybe half a teaspoon of red pepper, 2 teaspoons of mullein, 2 teaspoons of cardamom, and then 2 drops of eucalyptus oil in hot water. And then when it gets warm, you can drink it. That is once. So you make that and drink it once in the morning. You can make another one to drink in the afternoon, and then finally in the evening. They'll always
Please
help
repeat. I
with
lost you.
emphysema.
Please repeat.
Yes.
Please repeat
I was saying for. Okay,
Yeah,
the four herbs
for
are.
eucalyptus, cardamom.
The first one, we have eucalyptus essential oil, and then we have cardamom. I've sent it in the chat box, and then we have mullein. Mullein. We have red pepper, which
I'm
is
not getting
cayenne.
that one. Mullein.
Mullein or mullein. Yeah, I'm writing them on the chat box. Red pepper, which is cayenne, and then you can increase vitamin C intake. You can increase intake of vitamin C foods. The fruit with the most content of vitamin C is called camu camu. It's not here in Kenya, but you can always buy its extracts in online. Even in Healthy, you can find the extracts. But you can always find vitamin C in baobab powder. Baobab is in health stores around town, Nairobi. You can always take lemon. You can always take citrus fruits. And then I didn't write eucalyptus. Eucalyptus oil. Yes?
Vitamin C as well, tamarind.
Yes, tamarind has vitamin C. Yes, you can always make tea using tamarind or tamarind drink. So that's what I wanted to add on emphysema. And then on TB, on pneumonia, let me do pneumonia first. There's as Elisha said, what we need to do when it comes to pneumonia, number one, is to strengthen our immune system as we do away with the bacterial infection that is causing the pneumonia. And so the most powerful drugs the most powerful herbs when it comes to immune boosting, if you have any disease, be it a common cold, you can always use these drugs. Astragalus and echinacea, they're powerful immune boosters. Astragalus, it's an Asian plant, and echinacea, its nativity is in America. It's in America. So you can always use a combination of the two to boost your immunity. Probably when you're treating pneumonia, you can use a combination of astragalus, number one. You can write 2 teaspoons of astragalus. You can write 2 teaspoons of, I'll write the spelling of astragalus. Astragalus, it's in a shop in town. You can find it around Nairobi, and I believe those of us who are not in Kenya, they can be found in medical health stores. We have echinacea. So those are very powerful immune boosters. And then secondly, we have dandelion. Dandelion will help. Dandelion roots. We have dandelion. So 2 teaspoons each, not tablespoons, 2 teaspoons each. And then we have garlic. You can have 5 cloves, 2 to 5 cloves of garlic. So these are concoction we are making for TB. 2 to 5 cloves of garlic. And golden seal, we really don't have to use it. It's normally not easily found in Kenya. So I'll write onion. You can take a quarter or a medium-sized onion. So that would do with doing away with the disease and also boosting your immunity at the same time. And so there are also a few hydrotherapies that you'd also want to do for your patient. And an example is Russian steam bath. We'll learn how to do a Russian steam bath in time. With time, Russian steam bath will always help. And then a hot foot bath. Can always do a hot foot bath once in a day for 2 weeks. It helps in boosting immunity and improving circulation. The same thing to Russian steam bath. Russian steam bath will help the body create a natural fever, and when the body creates its own, when you create a natural fever from doing a Russian steam bath, what will happen is the immune system, the white blood cells will be activated to eat up the bacteria. So Russian steam bath and hot foot bath. Those ones we can also do it for, we can do the 2 hydros for pneumonia and TB. And then juicing therapy is also very essential when it comes to pneumonia. We'll talk about juicing. So we can, if you are skilled, we talked about a certain juice when talking about which, okay, no, not really, not that one, but we will talk about juicing. I might include them in my slides. So we'll just hold on to that point of juicing. And so lastly is on TB. We can use the same concoction that we've used for pneumonia for TB. We can use the same concoction, but for TB we can add licorice. It's very hard to get. You can only get it in Health EU. But if you don't really have to use it, you can use the same concoction as the one that I've talked about in pneumonia. That is echinacea, astragalus, dandelion, and the rest. So, by the way, there is also a common herb, though it's not sold, but you can always see it. It's a common flower. It's called honeysuckle. It's very, very, very good for respiratory problems. You can just go and Google this and see how it looks like. It's a very... That's its name. It's a very important remedy for respiratory infections. So you can always just go and Google and see. So for wet herbs, the dosage is normally twice the dry herbs. So that's all I wanted to add, Elisha. Thank you.
Maybe as you make concoction, do you use water? How much water?
Oh, I'm sorry, I really didn't include that. 500 ml of the concoction that I've mentioned. You put them in 500 ml of hot water, and then you just wait for that water to be warm. I'm really sorry I didn't mention that, but when we'll be editing the slides, we'll do a detailed explanation on how to do them.
So you steep the herbs in the hot water and wait for them to cool and drink.
Yes. So there are two ways we can prepare herbs. We talked about infusion or steeping, and for infusion we normally infuse flowers. We normally infuse leaves. We normally infuse the less delicate parts of the flowers. So that would mean astragalus, echinacea will be infused, and onion, they'll be prepared by infusion. But for dandelion, and probably if you get licorice, you'll have to prepare them first by decoction. Like you boil them in 500 ml of water. Once you've boiled and put off the fire, you can add now astragalus, echinacea, and then it's steep, and then just infuse them. Let them just stay there in hot water for about 30 to 40 minutes. Once the water gets warm, you can take it. I believe we've talked about that, how to prepare herbs, but we'll talk about them more when we'll begin our unit on herbology and botanicals. So that's just it for now. Infusion or decoction, we can always use one one way of preparation, depending on the nature of the herb. If it's a root or a bark, you have to boil it for about 15 minutes in hot water, 10 to 15 minutes in hot water. There are leaves that you can steep for about 5 minutes once the water has started boiling. And then there are those that you just have to put off the fire first and then put them in hot water, close the lid, wait for the water to warm, then strain and drink. I believe that was the question was addressed.
Yes, thank you so much.
Okay, so